All right, today we're putting on our detective hats. We're going forensic, diving deep inside our very bones to investigate one of the most vital, but honestly, most overlooked parts of the body, the bone marrow.
I mean, what kind of stories can it really tell us about an animal's life? Its struggles, maybe even its death. Let's do it. For the next few minutes, you and I are going to be pathologists, and we're going to learn how to read the clues left behind in this amazing hidden world.
So, before we can even begin to understand how things go wrong, we gotta know what right looks like. And the absolute best way to think about bone marrow? Forget just spongy tissue. Picture this. It is the body's most critical, high-stakes factory.
And what's this factory making? Blood cells. The fancy official term for this whole manufacturing process is hematopoiesis, but really it's just the production line for, well, everything. Every single red blood cell, white blood cell, and platelet you have, they all punch their first time card right here. It is a non-stop life-or-death production line.
Okay, so this factory, it's basically got two main departments. You've got the red marrow. Think of this as the loud, busy, 24/7 factory floor where all the action, all that hematopoiesis is happening. And then you've got the yellow marrow. This is more like the quiet warehouse out back, just storing fat for energy. So production and storage. Simple as that.
What's really cool is that this factory totally remodels itself over a lifetime. In a newborn, it is just full throttle, max production. Almost the entire bone is red marrow. But as an animal gets older, you don't need to be cranking out cells at that insane rate. So the body's smart. It converts some of that factory floor back into warehouse space, eventually hitting this nice, stable balance in adulthood.
Which brings us right to our baseline, what a healthy adult factory should look like. It's a pretty simple ratio, about a 50-50 split. Half active red marrow, half yellow marrow for storage. Burn this 50-50 image into your brain because this is our definition of normal. And it's exactly how we're going to spot trouble.
Okay, so what happens when that perfect 50-50 balance gets thrown completely out of whack? How does a pathologist walk in and just know something's gone wrong? Well, it turns out they're looking for three main visual clues.
These are like the top 3 questions on any investigator's checklist. Number 1, is the factory floor looking way too red, like it's in total overdrive? Number 2, does it look weirdly gelatinous and see-through, like the whole place has been cleared out? And number 3, has some kind of intruder moved in and staged a hostile takeover? Let's break them down one by one.
All right, clue number 1. The factory is seeing red. When a pathologist cracks open a bone and sees this deep, intense red color, that is a huge signal. It means the factory is working overtime. The official name for this condition is hyperplasia.
And you can see the difference so clearly here. On one side, you've got our healthy 50-50 split, but on the other, with hyperplasia, whoa, the red marrow has totally taken over, pushing out all that yellow marrow. The factory literally tore down its warehouse walls to build more assembly lines. Why? To meet some kind of crazy, off-the-charts demand?
So what kind of crisis would cause that?
Well, the body is smart. It's responding. Let's say there's a major hemorrhage or anemia. The factory floors it to pump out more red blood cells. Or maybe there's a nasty infection. It switches gears to crank out an army of white blood cells. It's a totally logical and really powerful emergency response.
Okay, so that's overdrive. But what about the complete opposite? What if the pathologist looks and the factory isn't just quiet? It looks empty. This is our second clue, and it points to something called serous atrophy.
Yeah, serous atrophy of fat sounds super technical, right? But the reason behind it is just brutal. It's starvation, pure and simple. When an animal is so starved that its body has absolutely nothing left to burn for energy, it goes for the last resort, the fat reserve stored in the yellow marrow. The factory warehouse has been picked clean.
And what's left behind is just eerie. The source material calls it a gelatinous transformation, which is a perfect description. The fat is just gone, replaced by this clear, wobbly, jelly-like stuff. It's like you're looking at the ghost of the factory's warehouse, a really clear and frankly tragic sign of extreme starvation.
Okay, we've seen a factory in overdrive, and we've seen a factory that's been starved empty. But this last clue, this one might be the most sinister of all. We're talking about a hostile takeover. An invasion. This is when something completely foreign moves in and just replaces the healthy marrow. The umbrella term for this whole mess is myophysis.
Myelophasis basically means the factory floor is being paved over with concrete.
All that amazing, life-giving machinery, it's being choked out, crowded out, and replaced by junk that doesn't produce anything useful. And when that happens, production of those essential blood cells just grinds to a halt.
So who are these invaders? Well, there are two main culprits. First, and most obvious, is cancer, what we call neoplastic tissue. But the second one is a bit different. It's not cancerous, but it can be just as destructive. We're talking about thick, fibrous scar tissue. That condition is called myelofibrosis, and it can actually be triggered by things like certain drugs or even infections.
Now, when you think of cancer in the bone marrow, of course you think of leukemia. And leukemia is the ultimate hostile takeover because, get this, it's an inside job. It's not an invader from the outside. It's a cancer of the factory's own workers, the blood-forming cells. It's a full-blown rebellion that starts right on the assembly line.
And you know, this is a super important point. People get these two confused all the time. Leukemia starts in the bone marrow factory. It's born there. Lymphoma, that starts somewhere else, like in the lymph nodes, and then it can invade the bone marrow later. So think of it this way. One is a rebellion from within, the other is an invasion from without.
Okay, let's wrap up this investigation with a quick summary. Our 3 clues give us 3 clear verdicts. You see intensely red marrow? The verdict is factory overdrive or hyperplasia. You see that weird gelatinous look? That's a factory shutdown from starvation, serous atrophy. And if you see something else has moved in, that's a hostile takeover, myelothesis.
So what's the big takeaway here? It's that bone marrow isn't just some boring stuff inside our bones. No way. It's a living, breathing diary. It's constantly changing, constantly reacting, and it records the whole story of an animal's life. Its biggest battles, from infections to injuries, from starvation to cancer. And if you know how to read it, you can piece together that animal's incredible fight for survival.
And that really makes you think, doesn't it? I mean, if our bones are holding histories this detailed, just imagine what other incredible stories the rest of our bodies are just waiting to tell us.